Thanks for watching the video on Medicare supplement policies, sponsored by Senior American Agency and MedicarePlanChoice.com. If you have questions during business hours, 8 a.m. to 3 p.m. Eastern Standard, call our toll-free hotline, 800-332-7557, or send an email to dan@senioramericanins.com. At this point, you should be familiar with the overview of Medicare and the two ways that you can receive your Medicare benefits. This video will focus on the choice of a Medicare supplement policy to enhance the original Medicare Part A and B benefits. These policies are also known as Medigap policies. We'll look at the specific benefits within them and the standard lettered plans. We'll also help you correlate those benefits to the gaps left over after original Medicare pays. At this point in time, you should have an understanding of the two ways that you can receive your Medicare benefits, and we're just going to highlight some of the differences between the two. On the left-hand column are the attributes of original Medicare. On the right-hand column, the attributes of a Part C Medicare Advantage plan. Under original Medicare, Medicare itself does the physical administration and pays the bills. Many people will opt to have a secondary policy, a Medicare supplement or Medigap policy, to help fill in the gaps after original Medicare pays. And many people will also opt to have a separate Part D plan to carry drugs because original Medicare nor the supplemental policies carry drugs. One of the advantages of original Medicare is the fact that there's no networks and there's no restrictions. You can see any doctor and go to any hospital in the country as long as they accept Medicare as payment. And by combining a Medicare supplement policy with the benefits of original Medicare, you can have a very comprehensive coverage. As a matter of fact, at this point in time, the Plan F with original Medicare covers 100% of the medical expenses that are covered under Medicare. So you can have a policy that literally has 100% coverage between the two. With Medicare Advantage, on the right-hand column, Medicare Advantage plans, as we had stated in the past, are all administered by private insurance companies, and many will have those network or doctor restrictions that you can only go to certain doctors or certain hospitals within the plan service area. And many of them have co-payments that can obviously add up. Those plans are divided into individual categories, each category having a different co-insurance or co-payment that would be due upon taking the service. And many of those Medicare Advantage plans do include a Part D drug benefit. So again, those are just the attributes, some of the attributes of original Medicare and some of the attributes of a Medicare Advantage Part C plan. One of the statements that we just made is that when you combine original Medicare with a comprehensive Medicare supplement policy, you can have little or sometimes no out-of-pocket expenses for big items like hospital stays, skilled nursing stays, outpatient surgeries, medical equipment, ambulance costs, chemotherapy and radiation. These folks are kind of the big out-of-pocket expenses that people worry about. What if I had a heart attack and needed heart surgery? What if I got cancer and needed cancer therapy, chemotherapy, or radiation? We know that you can literally have a zero out-of-pocket expense when you combine original Medicare with a Medicare supplement policy. With a Medicare Advantage plan, there's a lot of question marks because each one is operated differently, and you again have to examine the evidence of coverage or the outline of benefits prior to enrolling into the Medicare Advantage plan so that you know up front what the out-of-pocket expenses are for the different services that you might receive. So the one thing that you know is that your big bills can be covered very comprehensively when you combine original Medicare with a Medicare supplement policy and with a Medicare Advantage plan. That might not be the case. There might be other out-of-pocket expenses. Some of the obvious reasons why we just discussed that people would have a Medicare supplement policy. Number one, you can get a very comprehensive health care policy when you combine original Medicare with a supplement. We talked about the fact that you can budget your healthcare expenses so that you know what your monthly and annual costs are going to be up front, rather than determining paying service to service as you would with a Medicare Advantage program. Again, the freedom to visit any doctor, any hospital in the country is very important, so there's no networks, no referrals, no pre-authorization. And another important reason is the fact that Medicare supplement policies are guaranteed renewable. That means that they can never cancel you because of your age or because of your health conditions. They can't charge you any more premium than the next door neighbor. Everybody is going to pay the same rate with the same plan and company. So those are some of the reasons why people would choose Medicare supplement policies. Before we can examine what a Medicare supplement policy would cover, we first have to take a look at what Medicare itself covers, because Medicare would be the primary insurance and the Medicare supplement policy would be a secondary payer. So we first must look and see what Medicare itself covers. What you'll see on the screen is a chart with actually 4 different columns. The first column being the type of service that you might use. The middle column is what Medicare itself will cover, and the third column is what your responsibility would be after Medicare pays. Now, what your responsibility is can be put over to the fourth column, is what a Medicare supplement policy can cover. So what a Medicare supplement policy can cover are exactly those benefits that are left behind after Medicare pays. Depending on the type of plan that you have with the Medicare supplement, depending on the letters, some or all of these benefits can be covered. So we'll take a look at the first horizontal column, which is what they call the Part A deductible. If you're confined into a hospital, if you're admitted, that sparks, the day of your admission sparks a 60-day benefit period. During that time period, Medicare will pay for most confinement costs after you or your insurance pays the Part A deductible. The Part A deductible for the year 2016 is $1,288. And that amount is your responsibility. However, if you have a Medicare supplement policy that has the Part A deductible benefit within it, that will cover the full Part A deductible, the full $1,288, and you wouldn't be responsible for any dollars if you had a Medicare supplement to pay that for you. The second column is, put a loose term, the second and third column of extended hospital days. I should say the second, third, and fourth column, because it wouldn't happen unless you were hospitalized longer than the initial 60-day benefit period. So if you're hospitalized between 61 to 90 days, again, Medicare will pay all eligible expenses, but either you or your insurance has to pay the $322 per day copayment. So $322 a day times 30 days could be as much as $9,660 out of pocket. That again can be covered under the basic benefits of a Medicare supplement policy. That's the minimum threshold of coverage that a Medicare supplement policy can have. So if you have any Medicare supplement policy at all, letter A through letter N, they all include the basic benefits of the policy. So they would all cover those extended hospital days, the 61 to 90. The second one would be days 91 to 150, which are referred to as lifetime reserve days. That just simply means you can only use those days once in your lifetime. During that time period, again, Medicare will pay all eligible expenses. You or your insurance are responsible for $644 per day. So that times that 60-day benefit period could be a bill for as large as $38,640. Again, if you have a Medicare supplement, it does contain basic benefits that will pay that for you. The fourth column would be extended hospital plus reserve days. From days 91 to 150 are the lifetime reserve days. After 150, Medicare pays nothing, and you or your insurance are responsible for all costs. Most Medicare supplement policies will continue to pay for an additional 365 days beyond Medicare. So again, if you have Medicare supplement coverage, you don't have to worry about those out-of-pocket expenses. The last column would be the skilled nursing confinement, and this is where you're actually confined into a skilled nursing facility. Typically that's for short-term rehabilitation, but it can turn into a long-term stay. Medicare itself will cover 100 total days. The first 20 days, Medicare will pay for it 100%. So if you're in there for 7 days from a hip replacement or a knee replacement, Medicare can pay the whole shot for you. Beyond the first 20 days, Medicare will continue to pay for an additional 80 days to make up the 100. During that time period, you or your insurance has to kick in the remainder of $161 per day. If you multiply that by the 80 days, $161 a day could be up to $12,880. And most of the Medicare supplement policies, not all of them, but most of them do cover the skilled nursing benefit. So the three items that we feel are most important to be covered under original Medicare, the first item would be the Part A deductible, the first day in the hospital, and that could be as much as $1,288. That's important because not only is it expensive, but it can happen more than once a year because there can be more than one 60-day benefit period. If you're hospitalized 68 days after the first one, then there would be a second, and there could be a third and a fourth and a fifth charge based upon the number of 60 days in a year. The extended hospital days, again, if you have any Medicare supplement coverage, the basic benefits are included in all Medicare supplement policies, so you'd have coverage to cover any of those extended hospital days. And again, most of the Medicare supplement policies will cover the skilled nursing benefit. We'll get into the specific policies that cover each one of these in just a moment. That will cover days 21 to 100 in a skilled nursing facility. So that's just a wrap-up of what Medicare itself pays for, what a Medicare supplement can do to help cover those additional expenses. And up next, what we'll look at is Part B Medicare. Next, we will look at Part B Medicare. Medicare Part B is considered the medical expense category of Medicare and pretty much consists of any service that you receive on an outpatient basis, including outpatient hospital services like outpatient surgeries and so forth. So it can be any service that's provided on an outpatient basis. It can be medical equipment, wheelchairs, walkers, could be ambulance bills. There's a broad category of expenses that we're going to fall under Part B Medicare. Medicare Part B generally consists of an 80-20 coverage. Most people are familiar with the fact that Medicare pays 80% of the medical expenses, and obviously that leaves a 20% balance for either you or your Medicare supplement policy to cover. Many people obviously want coverage for the 20% because 20% of medical services today can add up to a lot of money. Before Medicare begins to pay their 80%, there is an annual deductible. In the year 2013, it was $147. So you need to pay the first $147 before Medicare begins to pay the 80%. And Medicare does pay 80%, but not necessarily 80% of the bill. Medicare pays 80% of the amount that's approved by Medicare. So they pay on a schedule that whatever the approved amount is, that's what they pay 80% of. And then either you or your insurance covers the other 20% of the balance. There are a couple other items under Part B of Medicare. Clinical lab services. Many of the clinical lab services are paid 100% by Medicare. That leaves no balance. And blood is considered a Part B expense. Medicare pays after the first 3 pints of blood, and either you or your insurance has to cover the first 3 pints of blood. So generally, Medicare Part B is any expense that's covered given on an outpatient basis. Medicare pays 80% of those expenses, and either you or your supplement has to cover the other 20% after a $147 annual Part B deductible. And the 3 items that would be covered under the basic benefits, or I should say the 2 items under Part B, would be the 20% of the balance and the first 3 pints of blood. Because those are in the green color scheme, they equal the basic benefits. So if you have a Medicare supplement policy, they have to cover the minimum of the basic benefits, which would be the 20% and the first 3 pints of blood under Part B Medicare. Medicare supplement policies are standardized in most states. What that means is it doesn't matter what insurance company you buy the policy from, you're getting a standard list of benefits in standard policies. The policies are designated by letter: Plan A, Plan B, Plan C, D, F, G, K, L, M, and N. So every company has the standard policies. So the only differential between companies would be the reputation of the company you're buying the product from, their financial strength and ratings and how long they've been in business, etc. The service that you might get from that particular company or that company's agent, and how much you pay for the policy, because although all the plans would be standardized, not all companies would charge the same amount for each plan. So let's take a look at the plans themselves. The way it works is what's listed underneath the letter is what's covered underneath the plan. As you can see, Plan A would be considered to be the least comprehensive because it has the least amount of coverage in it. Plan F is considered to be the most comprehensive, and Plan F is considered to be the most common Medicare supplement plan choice in the country. We do highly recommend that policy, although it's generally one of the higher premium plans as well. So let's take a look and dive into the benefits within these standard plans. As you can see, the three color scheme that we had, with the basic benefits being horizontally across the first line, the Part A deductible horizontally on the second box, and the skilled nursing coinsurance horizontally in the third box. Those are the three core benefits that we feel are important, and those are the ones that our clients typically ask to be covered for, because they are typically the highest out-of-pocket expenses. As you can see, Plan A does not cover the Part A deductible or the skilled nursing, and Plan B does not cover the skilled nursing. So we usually discount those policies and do not usually recommend them because they don't give the core benefits that most of our clients are asking for. The plans K, L, and M have asterisks under several of the boxes, and that means they pay differently from some of the other policies. Essentially, plans K, L, and M are more of a high deductible plan. As an example, under the Part A deductible for the 2013 year would be $1,184. Plan K only pays 50% of that benefit, so you would pay the other half out of pocket, so that would be another almost $600 out of your pocket. And the skilled nursing coinsurance, it only pays 50% because that total added up to over $11,000. That could be another $5,500 out of your pocket. So high deductible. Plan L would cover 75% of those items and leave you a 25% copayment. M again is 50% on the Part A deductible and all of the skilled nursing. So because those policies are high deductible, we typically do not recommend those. They do have an out-of-pocket limits of $4,200 or $2,300. What that means is if you spent that much in out-of-pocket expenses after you paid the premium, from that point forward the policy would pay for the rest of that calendar year 100% on the benefits. So we do not usually recommend the high deductible plans or plans A and B. So the plans that we typically recommend that give you the core benefits that we discussed are C, D, F, G, and N. Of those policies, typically we recommend Plan F and Plan N. Those are the two policies that we feel give the core benefits. They cover the basic benefits. Obviously, that covers the 20%. The Part A deductible, which would be the first day in the hospital fully, and the skilled nursing fully, so you have no out-of-pocket expenses there. The difference between those two plans would be the Part B deductible, which for the 2013 benefit year would be $147. Well, that's obviously not a part that's going to wipe you out, $147 a year, and they both have foreign travel within them. Excess charges are addressed in plans F and G. Essentially what that means is if by law they're able to charge more than the Medicare approved amount, we discussed that Medicare pays based upon their approved amount. If the providers are able legally to charge more than that, they would cover the excess charges, the amount above the Medicare approved amount. Many states, however, do have laws in force to protect the consumer and not have them the providers themselves able to charge a maximum of percentage, or so that may may not be a benefit that has value. You would have to look at your state laws to see how important that would be in your particular area. But Plan F is typically a high benefit plan with one of the higher premiums. We like Plan N because it gives you the core benefits. It gives you that first day in the hospital. It gives you the 20% and the skilled nursing. So those are the big bills. It leaves $147 once a year, which is no big deal. And it has an asterisk under the basic benefits. The reason why that's there is because Plan N, you do pay a $20 copay if you go to either a plain Jane doctor visit, whether it be a specialist or a primary care physician. You pay a $20 copayment. And if you're admitted to, if you're go to the emergency room and are not admitted, I should say, to the hospital, then you do pay a $50 copay for the emergency room. But if you're admitted, then it goes back to the Part A deductible and it's fully covered under that benefit. So the two policies, as we discussed, that we typically recommend are Plan F and Plan N. We would highly recommend those policies. I'd love to give you a quote right here and now on those two policies, but because they premiums differ by state to state, county to county, zip code to zip code, we can't give you a quote on this broad category. We will give you a quote if you call us on the phone or give us a email, a quote at 65medicareinfo.com. We will certainly get back to you with a quote for your specific area, and we will go into a little bit more detail next. But for right now, the standard policies that we typically highly recommend are Plan F and Plan N. We just looked at Medicare supplement policies and the benefits that they can cover after original Medicare pays. This screen is going to compare two of those Medicare supplement plans, specifically Plan N and Plan F, and what those particular plans cover and what the out-of-pocket expenses would be between those two versus a person with just original Medicare. So this chart represents a hypothetical situation in which these three individuals used certain services, a hospital stay, a 23-day skilled nursing facility stay. They paid towards the Part B deductible, and they paid Part B coinsurance for a couple of doctor visits. So again, we're going to compare the person with original Medicare, the person with Plan N, and the person with Plan F Medicare supplement. So all three of these hypothetical people had a stay in a hospital, and the Part A deductible for 2016 was $1,288. So the individual with just original Medicare had to pay that out of pocket. Both Plans N and Plan F covered that amount fully, so those individuals paid nothing. There was a 23-day stay in a skilled nursing facility, and we just looked at the fact that Medicare itself does cover the first 20 days. After the 20th day, it is $161 a day in a skilled nursing facility. So if there was 3 extra days, the original Medicare individual had to pay an additional $483, where the Medicare Supplement Plan F and Plan N individuals paid nothing because both of those cover fully the skilled nursing coinsurance for the full 100 days. The Part B deductible is the amount that has to be met before original Medicare starts paying. Both the individual with straight Medicare and the individual with Plan N had to pay the $166 annual Medicare Part B deductible. The individual with Plan F did not have to pay that because that's a benefit within that plan that would cover it. All three of these individuals had 2 doctor visits following up. We're gonna say that the $20 or the 20% copayment came to $40 for the 2 visits under original Medicare, and we know that Plan N charges a $20 doctor copay, so we'll call that $40 as well. The Plan F covers the outpatient doctor visits fully, so that individual again paid nothing. So if we total up the hospital stay, the 23 days in skilled nursing, and the 2 doctor visits, the person that opted for straight Medicare with no supplemental coverage paid a total of $1,977 out of pocket. The Plan N individual paid a much smaller amount, about 90% smaller at $206, and the individual with Plan F paid nothing. So again, comparatively a small amount of out-of-pocket expense with the Plan N. The reason why we do recommend that one is because the premium is very affordable in comparison typically to Plan F. So if we look at a person with Plan F Medicare supplement and a Plan N Medicare supplement, the idea being the bigger bills are going to be paid the same. Yes, you do have to pay some smaller out-of-pocket expenses, but you'll typically save a lot of money in premium with Plan N. So next we'll wrap it up and take a look at some things that you need to consider. Here we're going to look at a couple of items to remember for a person that's coming right into Medicare and getting a Medicare supplement right at the very beginning. The first thing to know about that is people entering Medicare for the first time are a guaranteed issue, and that simply means that there's no medical questions asked and all health conditions are covered even if they're pre-existing. So there's no pre-existing condition limitations for a person entering a Medicare supplement right when they're first eligible for Medicare. And you can do that during your initial enrollment period. So there's no medical questions asked. All health conditions are covered even if they're pre-existing. And policies are guaranteed renewable for life. And that just simply means that regardless of the number of claims and regardless of the cost of those claims, you can never be canceled because of your age or because of your health conditions. As long as you continue to pay your premium, it is guaranteed renewable for life. And many of the companies are offering competitive pricing for new Medicare members who purchase Medicare supplement policy right at the age of 65 or when they're first eligible for Medicare. And these are a few things to remember for a person coming into Medicare for the first time and looking into Medicare supplement coverage. If you are watching this video via a DVD disc, you might already have a quote included in your package. To take advantage of that quote, simply return the application with payment for the first month. To get a quote from the MedicarePlanChoice.com website, go to Get a Quote or Web Chat and follow the instructions. If you need assistance or need to discuss your situation, our telephone support line is open every business day from 8 a.m. to 3 p.m. Eastern Standard at 800-332-7557. To get a quote via email, send a request to dan@senioramericanins.com. Include your state, county, and zip code. If you're not just starting out on Medicare, include your age, gender, and smoking status. Thank you for trusting us to be your resource on Medicare information and products. We promise to give you our best effort with any need you might have as a client. And again, thank you for allowing us to fulfill our goal to be the #1 service agency for new Medicare enrollees. Thanks again.